We're kind of seeing some stabilization really in the cases. We would love to see them going down more, but they're running anywhere from 1,100 to 1,500. And you can kind of see by the up and down of this over the last 20, 21 days. If we look at the rest of it, nothing, every time we see deaths is tragic, 34 deaths reported. If you go down to the hospitalizations, actually this is consistent we've seen some downturn in hospitalizations, which is certainly a good thing to see. ICU admissions running about flat, kind of up and down every day. So that's where that is. Let's go now, Eric, to kind of this map of where we are. This was released yesterday. You've really seen some changes, and we'll talk about that in a minute. We have 11 red counties now. Mercer County is our only new red county. The others are Allen, Cuyahoga, Erie, Fairfield, Franklin, Licking, Lucas, Marion, Medina, and Montgomery. We've seen some positive movement going in the right direction, which we like to see. Henry County, Lawrence County, Hamilton County, all are no longer red. It's particularly significant, significant for all three, and I congratulate the communities. Hamilton County has been red all the way through this, and they've come off that, and that's certainly what we hope for all the red counties. Hamilton County is really a success story. The business community came together, Mayor Cranley, the county commissioners, everybody kind of pulled together, got the message out. Mask wearing is just vitally important. And the percentage of people in Hamilton County wearing masks out in public went up dramatically. And everybody got behind it. So we've seen some great results there. Very, very happy about that. We know the battle is not over. Hamilton County residents continue to wear the mask, continue to be smart about the social distancing, and just be careful. Hamilton County is still a fairly high number, but it's certainly a lot better than it was. And as we said, Hamilton County, it's great to see down here, the red is gone from that part of the state, or at least that part. Let's go up to a few other counties. Allen County, a group home outbreak jumped from 11 cases last week now to 13 more this week, for a total of 24 associated with the outbreak since mid-July. Typically, the average number of cases they report every day is 12 to 13. They had 117 cases during the past two weeks. Cuyahoga County, still red, but seeming to do better. They had a steady decrease in daily number of cases reported. And again, to folks in Cuyahoga County, thank you. Wearing the mask and keeping the social distance. They still, though, exceed the CDC's threshold for a high incidence, which is 100. They're at 114. During the course of a week, they dropped about 40 cases a day. So real movement in regard to Cuyahoga County. Erie County. Erie County cases remained elevated, although they had initial outbreaks associated with Put-in-Bay. The virus continues, unfortunately, to spread throughout the community. Down in Central Ohio, Fairfield County continues to have a high number of cases, 121 per 100,000. An outbreak in a long-term care facility has 14 cases so far. Informal gatherings also are driving increased case numbers. And again, that's what we're seeing, frankly, across the state. It's these informal kind of get-togethers. Franklin County continues red this week, in part because of new outbreaks related to restaurants, long-term care facilities, and a healthcare facility. Licking County. High number of cases is being driven by a church gathering that had 42 cases, and long-term care facilities also with significant numbers. Up to Lucas County, several outbreaks in Lucas County have contributed to high case counts. They include outbreaks at a daycare center, a local university, and a camping outbreak related to camping. Their numbers are high at 189. Now, Marion County. Marion County is close to dropping off red, but not quite there. Long-term care facility in Marion County has more than 60 cases, half of which were linked during the past week. Medina cases are increasing, unfortunately, in part related to cases associated with the manufacturing plant and family trips out of state to hot spots when they're bringing it back to Ohio. Mercer County. And Eric, why don't we switch over and we'll look at the counties in the row that we've put them. I'll just finish here. Mercer County, very, very high, 262 cases per 100,000 residents in the past 2 weeks. You'll see, this is the whole, you'll see the whole chart. Unfortunately, Mercer County is at the top of that. And we'll get to Mercer in a minute. Montgomery County, we'll go down to Southwest Ohio. Montgomery County remains red this week. In addition to community spread, they've had outbreaks in long-term care facilities, workplaces, and again, the family gatherings. So Eric, let's look at the top 10 counties. And again, this is what we did. We put these, I asked our team to put these in order, and you can pull those down from our webpage, all 1 to 88, all counties ranked. And again, what this is, to remind everybody, what happened in the last 2 weeks, how many outbreaks, but then it's reconfigured based on population. So if you take it by population per 100,000, population, unfortunately, Mercer County is way up there at 262. You'll see Lucas, 189. And if you look at these, what is, it's disturbing when you see any county, but what we're seeing is that the more urban counties where mask wearing is become very, very, very prevalent. It's the norm now by far. We're seeing a plateau and then starting to go down. In many of the rural counties, we're not seeing that. As you see more of the orange counties in the map we showed a minute ago, it's just spreading out into the rural counties. And if you look at the top 10 hottest counties, unfortunately, you go through these, and there's some small counties in here. Mercer County is one. Wyandotte County, Champaign County, Hancock, Darke County, Fairfield, Erie. So these are just no longer are they your big counties where the high concentration of people close together. These are the more rural counties, and it's of frankly grave concern to us. Let me just talk about, a little bit about Mercer County. They're red for the first time this week. They're showing an increase in patients in their emergency department, which is worrisome, according to local health officials. Now, Mercer County has had some significant big outbreaks. You can go way back in May, an outbreak on a farm, I think had 80 cases, 51 cases from an event, a funeral. 33 of those individuals were actually from Mercer County and brought it to Mercer County. But what's probably more significant or equally significant is that this is now spread to the community. Today, the virus is spread all over Mercer County. Their health officials tell us that it's in all corners of the county and is affecting people of all ages. So again, my plea to my friends in Mercer County, and it's a wonderful, wonderful county, is wear a mask, keep the distance, is the only way that we can slow this thing down. And we just ask them to please do that. Let's turn to Athens County. Athens County, some good news. Athens was on the watch list for risk of going red to purple, highest level on the alert system. They had several outbreaks at bars and restaurants and informal gatherings. This week they're yellow. They go all the way down to yellow. Their county health officials told us they're seeing many more people wearing masks. They also said they're discouraging smaller gatherings and have encouraged people to limit their contact with others. The residents are doing what they can to protect themselves and others. That's just great. Staying home when they can, hand washing, social distancing, wearing a mask. So all of these things for across the state of Ohio are what we obviously need to be doing.